Welcome back to Harmonize Your Life, Conversations on Self-Care for Women of Color podcast with your host, Dr. Toni G. Alvarado. We are now in the month of October. And as you all know, this month is a month that is dedicated often to breast cancer survivors. And last year we did a celebration of survivors last year, and we focused mainly on breast cancer survivors, and we also celebrated women who had survived domestic violence. But this year I want to do something just a little different because a lot of times breast cancer gets a lot of attention, particularly with women and with women of color. But there are so many other cancers that impact our bodies and our communities, our families, and all of us can admit to us somewhere in our lives being impacted by cancer. And so I've invited a guest on today to talk to us, not just about breast cancer awareness, but about cancer in general and some things that we might not know, things that we need to know, how cancer has impacted us and continues to impact us, and some ways, some preventative things that we can do to eradicate cancer in our bodies, in our community, in our families. So I'll be right back after this. Okay, so I have in the podcast studio with me a sister beloved, and I am going to read her bio. Tonya Phillips has 30 years of experience in community health and education programs. She currently serves as an American Cancer Society Cancer Control Strategic Partnerships Senior Manager. She and her team work directly with federally qualified health centers, hospital systems, and health plans in the state of Georgia. The team takes a quality improvement approach in working with those systems to improve their program cancer screening rates with a focus on breast, cervical, colorectal, lung, and HPV vaccination rates. Tonya sits on the Georgia Cancer Control Consortium, Georgia Colorectal Cancer Roundtable, and the Georgia HPV Work Group. Georgia ACS is currently hosting a cohort in a National Breast Cancer Learning Collaborative, which is focused on returning women for breast cancer screening post-COVID-19 onset. Tonya previously served as the Georgia Community Senior Manager for an ACS, Georgia Department of Public Health, Breast and Cervical Cancer Outreach Program. Tonya managed community health workers with a strong focus on identifying underserved, rarely screened women for breast and cervical cancer screenings. Will you help me today welcome my guest to the podcast studio, Miss Tonya Phillips. Welcome, Tonya.
Hi there, Dr. Toni. It's a pleasure to be with you.
Thank you. I'm glad to have you with us on today. And Tonya, as I was saying in my introductory comments, that all of us, whether we are cancer survivors or not, you like myself, we're not cancer survivors in the sense that we've not had cancer in our bodies. And heretofore, we've not had cancer in our bodies. And so it is incumbent upon us to educate our community. We know that this is, the month that most people are celebrating breast cancer, right?
Yes.
But we know that breast cancer is not the only cancer that we've been impacted by.
Absolutely. So, Dr. Toni, my first impact of cancer was at age 6, and I lost my father to liver cancer. My mother was 29 years old. I was 6. They had only been in the state of Minnesota 2 years. 22, 23 years later, my mother's youngest sister and the youngest in her family, who had moved to Minnesota to help take care of my father during his journey, prolonged going to the doctor because life happens. And she was diagnosed with pancreatic cancer, and she lost her battle at age 42.
Wow.
She died 1 week before I gave birth to my second daughter. And I remember thinking, I've lost my daddy at age 34. I've lost this baby sister. She was like a big sister to me at 42. I'm going to do everything in my wheelhouse to make sure that I'm very proactive in my approach to preventative screening. So at 35, I was raising my hand saying, there's cancer in my family. I need my mammogram. And little did I know, I've never had cancer, but my breast cancer health has been a journey all these years.
Okay.
So, you know, it's just those incidents and those experiences have shaped my life. But at the very same time, Dr. Toni, my mother, who cared for both my father and my aunt, said, I tell you what, I'm not doing any diagnostic testing. If I'm ever diagnosed with cancer, I don't want treatment. And true to her word, she lived to 80, but she had seen other siblings die of cancer. At 80, she was then also diagnosed with pancreatic cancer.
Wow.
And I'm hearing her message repeated with some of my family members, which is a little alarming because they're young like she was back when my auntie died in her 50s, saying, well, whatever the good Lord gives me, I'll take. Not understanding that prevention and early detection could save their lives or prolong their lives.
Wow. So your mother decided, well, and what age was she when because my grandmother died of cancer, but she didn't get diagnosed until she was in her 80s.
My mother was cancer-free until 80. 80 was age in her mind that she wanted to see. And at 80, she had lost all of her younger siblings and only her older brother, who was probably a 20-year prostate cancer survivor. But at age 50, she started saying what she wasn't going to do. And her health providers knew that. So she just didn't participate.
Wow.
She was very good about exercise. She stopped smoking. She tried to keep her diabetes and hypertension in check. But when it came to cancer, because of her experiences, she just said, I'm not going through it.
Wow.
Yeah.
Whew. Okay. So, but you know, and so Tonya, you know that that I just had my mom just passed away this year.
Yes.
So my life has been impacted by cancer, not just because of my mother, but my sister is a breast cancer survivor. And what's crazy is my mother, you know, was my sister's main support when she was going through her breast cancer journey. And then mom, in 2019, my mother was diagnosed with squamous cell carcinoma.
Yeah.
We had never heard of this disease before. We'd never heard of this type of cancer. So it started with a tumor in her jaw. And then it spread to her tongue. And my mother's never been a smoker. My mother was not a drinker, any of that. And so we were just like, where did this come from? You know? And so our lives were deeply impacted. Years ago, as I was saying earlier, my grandmother lived into her 80s before she ever experienced cancer. She died of cervical cancer. And she came from that era where women didn't go and get, you know, exams. You know, they didn't do those checks in their cervical area, you know, their the pap smears and things like that. They didn't do those things. And so, but by the time she was like 89 when she went home to be with the Lord, when she passed away. But she was like, you know, she didn't want any treatment. She didn't want any of that. She was like, I've lived my life. I've lived past the years God promised. And so she was okay with, you know, we just kept her comfortable.
Yeah. So I think there are a couple of things that you spoke about. One is that there are some cancers that we'll never know. We don't know right now what causes cancer. I can remember walking into to our chief medical officer at the time my mom was diagnosed with pancreatic cancer, and saying, I've lost, now this is the third or fourth family member from pancreatic cancer. What's going on? He said, Tonya, I can't tell you for sure. It could be genetic. It could have been environmental. They were all diabetics. We don't know right now. So there are some cancers that we just don't know, Dr. Toni, what causes them. But there are some that we do know how we can impact, our awareness of those cancers in our body, that there are screening measures that will help us in that journey. And those are the cancers that we really want to stay on top of.
And so let's talk about some of those. And like I said at the beginning, when I opened up, this is the month of October. And because we've done some work in the past around breast cancer awareness in our local church. You've come to our church and you've spoken to our women. You've encouraged the women to get their mammograms. You've given out information. We've had our Worship in Pink Sundays, and you've been a part of those celebrations. We've celebrated our survivors. One of our survivors, Jessica, that you developed a relationship with one of our survivors, and have really been a support to her. And then her mother recently had a battle with breast cancer, Melvina, and she's a survivor. So, every year we're celebrating our breast cancer survivors. But this year, I wanted to, and even in our church, we're planning on the fourth Sunday of this month to celebrate all of our survivors.
Yes.
And we usually dress in pink. But this time we're going to dress in the different colors of the women, of the cancer survivors in our church. So because like I have on this t-shirt today, and I almost didn't wear this t-shirt. I almost did not put this on. This t-shirt that I'm wearing says Margaret is winning, right? And it's the t-shirt that we had made the day that my mom, on March 18th, 2020, my mom rang the bell. She did her last radiation treatment. She didn't do chemotherapy, but she did do radiation treatment. And we had 6 weeks of radiation treatment, 5 days a week that she had to go through. She started in late January that year in 2020, and she finished on March 18, 2020. And so that day, we wanted to do a big celebration for mom, because she was ringing the bell, right? And so we got these t-shirts made. And that's when I found out about the different colors. Because I didn't know that the burgundy or the maroon color ribbon that's on my shirt is for head and neck cancer. So this carcinoma that my mom had, because it was in her jaw and spread to her tongue, it was considered head and neck cancer. Right. And so, of course, she did her treatment there at Emory, there at Emory Midtown Winship, and I was there. We were there with her quite a bit. Just seemed like for a minute that's where we lived. But I didn't know about the different color ribbons until we got these t-shirts made for mom, because all I ever saw was the pink ribbon, because of breast cancer. And so I didn't know that there are different colors for each cancer that represent the different cancers that people suffer with or have been healed from.
Yeah. But Toni, your mom was winning at the time. Your mom was winning at the time. And a cancer diagnosis is a journey, right? Yeah. And so some of us will survive and have survival periods in our lives and may never have a reoccurrence. Some people are living with cancer. I have somebody very close to me who's now living with cancer, who's in pretty good health right now, right? But we do have to celebrate all those milestones. And it's okay to have the conversations before cancer strikes us about what that might look like within our families. What do our relatives want in their lives? If it's, I know some people say, don't unplug me because there may be hope 20 years from now. Yeah. Okay. But what does that look like? And to have peace for that person who's going through that journey, if they should come to the end of their journey, and then to have that family also be at peace with the decisions and the options that were taken on behalf of their family members.
And that is so important because we have my sisters and I, we have no regrets.
Mm-hmm.
We know that we took the journey that we were supposed to take with mom. Mom took the journey that she felt comfortable taking.
Mm-hmm.
She did, because when the reoccurrence came, when it spread, and she got a new diagnosis this year in January.
Right.
And the option was there for another surgery, and she chose not to do it. And we said to her, Mom, whatever you do, we're going with you. If you want to do the surgery, we're going to go with you there. If you don't want to do the surgery, we're fine. And she chose not to do the surgery. I always said Mom died on her own terms. Mom knew what she wanted. She planned everything. She told us everything. We read one of the blessings. My mom called me over to her house on May 8th. I got it in my phone right now. That's how I know the date, because I wrote it in my phone. She called me. She said she wanted to talk to me and my husband. And we went over there, Bishop Alvarado and I. And she said, I want to talk to you about what I want for my service. And I said, okay, Lord, am I ready for this? And so I wrote everything down, and that was May 8th, and she transitioned on May 28th.
But Toni, it wasn't that a blessing?
Yes.
Wasn't that a blessing? My mom did the same thing. And I tell people I'm sad that I've lost my mom, because I spoke to her every day. She lived in Ohio. I'm in Atlanta. But I know that she was at peace. I know she died the way that she wanted to. And I know that the day she died, it was unexpected.
Yeah.
But God's grace showed up, because she had met with the pastor that morning. And she said, when God reaches down for me, I'm ready to go.
Wow.
And at the time of her death, she was in the bathroom, and she extended her hand, and she was gone.
Wow.
That's nothing but God's grace.
It's nothing but God's grace. And so I like I said, I almost avoided. This shirt has been hanging in the closet, right? And I've looked at it several times since Mom transitioned, right? And I was like, oh, well, I guess I won't wear that shirt anymore or whatever. But then the Holy Spirit spoke to me and said, she's still winning. She won then, and she's still winning, because she won a crown of life. She won a crown in heaven. She won because she fought until she couldn't fight anymore. She won because she left a legacy behind for me and my sisters, a legacy of faith, a legacy of determination. She won. And so I proudly wear this shirt today in honor of my mom.
Yes.
Because
I salute you for that, Toni. I think so many times, many of us are afraid of death, right? But when my mom passed, I felt joy, because, like you said, I knew that this life is only for a minute, right? And her faith, the night before, she had my niece come over, who's a beautician, and cut her hair very, very short, arch her eyebrows. And she said, I'm getting ready for my boyfriend.
Wow.
So to know that she's in the place that she desires to be in, you can't do anything but celebrate.
You can't. So those are ours. We have both been impacted by cancer at deep levels. And I'm sure that many other persons who are listening to us on this podcast today have been impacted by cancer. And some of them may even be cancer patients or survivors. And so let's talk about what are some stats, some of the leading cancers, the incidences and mortality rates. Can you talk to us about some of those leading cancers?
So for 2021, this year that we're currently in, for males, the leading one cause of cancer is prostate cancer, with close to 250,000 estimated cases, 26% of those cancers for men. For breast cancer, it's closer to 300,000, 30% for women.
Wow.
Then the second for each is lung and bronchial cancers. 12% for men, 13% for women. Colorectal comes in third at 80,000 or 8% for men, and then 8% also for women. Now, when you go down to the causes of the estimated causes of death in cancer, lung cancer raises to the top for both. So 22% of male deaths from cancer will be from lung cancer. Also for women, 22%. Prostate cancer, 11% of those cancers for men. Breast cancer, 15% of cancers for women. And colorectal cancer is third for both with 9%. for men and 8% for women. Now, the interesting thing about those 4 cancers is that there are screening tests that are available.
Wow.
So, you know, some cancers, like the cancer that your mom had, was probably difficult to diagnose. My dad's liver cancer back 50-something years ago, he diagnosed himself seeing an article on TV and said, I think that's what's wrong with me.
Okay.
And pancreatic cancer is still a very difficult cancer to diagnose, right? But even pancreatic cancer, if caught early, is survivable, but it's catching it early. So I'm going to talk about 2 things. I'm going to talk about the screenings for each one of those, right?
Okay.
And I want your listeners to know that they can always go to www.cancer.org. That is our ACS.
I'm going to put that on the screen for those, because and those of you that are listening to this podcast, because you know we're audio and we're also on YouTube, so they can see it. So what is the website?
It's www.cancer.org.
Okay.
Let me make sure, because my homepage is yes, cancer.org.
Okay.
And when you go to that page, there's a plethora of information. But if you go under the Stay Healthy tab, you can pull up the cancer screening guidelines.
Okay.
And it's pretty interactive.
Okay.
So I want to share with folks that the guidelines are guidelines, right? It's for typically at-risk people. So when we talk about, and they're subject to change, right? Based on science, based on trends. So I've been with the American Cancer Society now for 10 years. When I started, the recommended starting date for colorectal cancer was age 50. I remember talking to a African-American GI, trying to get him on a campaign that we had. And he said, Tonya, I don't agree with your guidelines. And I said, why? He said, because in my practice, I see African-Americans being diagnosed at earlier ages, and your guidelines need to say 45. Our guidelines now say 45, right?
Oh, wow.
We're starting to see younger and younger individuals with colorectal cancers. And so the talk now is to start at age 45.
So we should be, so the screening for
colorectal should start at 45.
45, okay.
Right. Now, some insurance or some plans may or may not pay for that, but talk to your provider and suggest that. Okay. If you have a family history of colorectal cancer, you know, if my mom had colorectal cancer at 45, I wouldn't want to wait till 45. I want to start 10 years prior to that.
Yeah. And I think that's the same thing with breast cancer, right? If you've had
it is for most of them.
Most of them. So if you've had it in your family, then you should be screened sooner.
So I always share with people, don't wait till the guidelines to start, the guideline recommended ages to start the conversations with your provider. Start early. Okay. You know, start early. And then you and your provider can determine the best plan for you. So if you're, you know, at risk, determined to be at risk or higher risk, there may be a recommendation to start earlier. If you see changes in your body, if I was having a bloody stool at age 20, right? But the guidelines say for me to start at age 45, that bloody stool would indicate that I would need at least a colonoscopy to make sure there was nothing going on in my GI system, right? So for breast cancer, the breast cancer guidelines have changed over the years too. We at the American Cancer Society say between the ages of 40 and 44, you can start mammography, have that discussion with your provider, but no later than age 45 should you have your first mammogram. Now, I will throw in a caveat to this, Dr. Toni. Again, I've spoken to some Black breast surgeons or specialists who say because African Americans present at later stages often with more aggressive cancers, they don't want just to have a conversation and let's decide. They're really promoting let's start mammography at age 40. And that doesn't really differ than what we say, but we say it's a conversation. Okay. Right? Okay. So knowing your history, knowing your body, if again at age, thinking about Jessica, who kept saying, there's something wrong, there's something wrong. Right. It had to go through a number of folks, but that was the only way she was diagnosed, right? She didn't walk away just from that first one saying, oh, it's nothing.
Mm-hmm. Okay. Wow. This is one of the reasons why I love talking to you, Tonya, because you're such like a wealth of knowledge when it comes to this.
Yeah.
And I love the way that you take the fear out of it, or you know what I'm saying? You make it common conversation, because sometimes these conversations are, and then sometimes it's not easy. It's not easy to understand. Some people explain things and it's so way out here you can't understand it. But I like the way you explain it, because you make it so. As one of my friends would say, you put the cookies on the low shelf.
Awesome. I just want to share with your audience as well. Cervical cancer screening begins at age 25, right? That guideline has changed. I don't know if you remember back in the day, it would be an annual event, right? I would sync it with my birthday.
Okay.
Now, if you have an HPV test and that test is negative, and you've had no other issues with, your reports previous, you can go every 5 years. If you don't have that HPV, you go every 3 years. If no former history, or you're not having any issues, but you should go every year for a pelvic exam. And
should you go for a pelvic exam? What do you say to women who may have had hysterectomies, or they're not having children anymore?
If they still have a cervix, they need to go.
Okay.
And you can typically stop that at, I'm looking at my cheat sheet here, at around 65 if you have no problems. But if you've had any issues in the 25 years before that, you're going to continue the screening.
Okay. Okay.
And then there's also lung cancer screening if you've been a smoker or a former smoker. Starting at age 55, you need to have a conversation of whether or not you need to have a lung cancer screen. And that screening process or interval should last until you're 74. Most of the cancer screening test, the end date is 10 years from when you think 10 years that you still see yourself having a healthy life. So like my mom at age 80, and your mother at, your grandmother at age 89.
My mom was 74, 73 when she got diagnosed.
So your grandmother, who was 89.
Yes.
They would not have been
when she got diagnosed. Yes.
But they would not have been saying at her age, get your cancer screen.
Right.
Because it then becomes a matter of, what are we going to do? She's lived this life. Is it, is it worth her going through treatment? Is it going to extend her life, 20 years? Probably not at that age, right? And again, that's a conversation that individuals can have with their providers.
Okay. So what about, it's October, so it's breast cancer. We're doing a whole lot of, you're hearing a lot about breast cancer this month. So can you give us some breast stats?
Sure. So again, in 2020, it's estimated that 281,000 plus women will be diagnosed with invasive cancers. 2,500 men will be diagnosed with cancer.
And see, now that's something, because a lot of people don't realize men, I remember the first time I discovered that was we had a man in our church. We were doing all this, breast cancer survivor stuff, and we had all this stuff for women and stuff. Then one of the brothers raised their hand like, I've had breast cancer, and we didn't know what to do with him. We didn't know what to do with that.
Right. So it's being in tune with your body, knowing your family history. I know of a family that the person my age is now a breast cancer survivor, but her aunt, her father's sister had died of breast cancer. After this girl's diagnosis, her father had some discharge from his nipple. He is now living with breast cancer, but he was in tune. He at first was a little dismissive, but his daughter said, no, we have breast cancer that runs in our family. You need to go get it checked.
Wow.
Yeah. So being in tune
is really good, because, generally my audience is the audience for this podcast are women. But it's so good because a lot of times as women, we become that voice in the lives of the men in our lives.
Mhm.
We're that voice to tell them, because they're not as quick to go to the doctor as we
Right.
are.
Right.
Or, they'll ignore things. But when it comes to our husbands, our sons, our brothers, our fathers, and other men in our lives,
Right.
we have to sometimes bring those things to their attention and make sure that they go get the screenings that they
Right.
need to get.
He said, maybe a mosquito bit me. Okay. And left
Mm,
blood coming out your nipple. But that was
yeah.
his way of being dismissive of it.
Okay.
So, and then there's going to be about another 50,000 women who are diagnosed with what is essentially stage 0 cancers that are very, very early. They haven't spread further than the wall.
Wow.
So, in the state of Georgia, the state that we both live in, there's going to be an estimated new cases of 8,700 cases of breast cancer in women and 1,400 deaths this year related to breast cancer.
Why is that? What do they base those numbers on? What?
Sure. So cancer deaths have to be reported.
Mm-hmm.
And the state has those statistics, so we can get those numbers quite easily.
Okay.
But they're looking at trends, right?
Mm-hmm.
And seeing where it's going. We know that when you talk about African American women and white women, and I'm not going to discuss Asian and Island Pacificers today or Hispanic, they typically have lower incidence and lower death rates than whites and blacks.
What? Asians
and Hispanics.
Wow. Okay.
Yeah. And there are all kind of theories, but I'm just going to talk about whites and blacks today. So when you look at the incidence, you look at the cases for those two populations, it's very, very similar. Very similar. But when you look at the death rates, there's almost a 9% difference between, and African Americans are higher, right, in those death rates. And so over the years, all women have been trending down in death related to breast cancer, but the gap between white women and black women remains large, significant.
And what could be some of the factors for that?
Some of the factors are, again, reporting, getting a later stage diagnosis.
Okay.
And some of that, when we talk about health equity, when COVID-19
I was
hit,
going to ask you.
there was all this talk
health
about
equity.
health equity and health disparities, right? We've known that for years.
Yes.
But it just brought it to the forefront.
COVID just exposed it.
It exposed it, the little nasty secret that not everybody wanted to talk about.
Yeah.
So when you talk about health equity, and it's different than health equality. So health equality is you get a bike, you get a bike, you get a bike, and those bikes are all the same size. But I'm 6'7", and I have a child that's 2. We can't ride the same bike and have the same outcome. So health equity is having those resources available that meets individual needs. So when we talk about health equity in our communities, we're talking about, I live in a community, Dr. Toni, I can walk to maybe 3 providers. But if I live in South Georgia, I'm going to have some kind of transportation.
That's right.
If I need a specialist, I probably need to go somewhere overnight or it's an all-day kind of thing.
Yeah.
If I don't have health insurance, I can't take off work and go sit at Grady all day and wait for an appointment.
Exactly.
For fear of losing. So we really are
the
trying
disparities and even the cost. When I was going with my mom a couple of times, mom had to have screenings, MRI or something like that. And I mean, thanks be to God. I'll never forget one time I can't remember what test she had. She had to have I want to say it was an MRI.
Okay.
But we went down there, we found out, they sent us down, we went upstairs for her exam, her appointment with the doctor. Then they sent us downstairs to get her set up for this test. And just like nothing, they were like, okay, that's going to be $800.
And if you didn't have it, what would have happened?
And, and I would, whenever I would just take, we didn't let her pay for anything. Me and my sisters, my husband, we didn't let her pay for anything. So I just took it. Mom, I got this. And I paid it. Yeah. But what if I didn't have it? What if she didn't have it? What if our family didn't have those resources to just pay for an exam that costs $800? And listen, you don't even have any, it's not like something that you could schedule and plan out, right?
Mm-hmm.
It's something you got to have right now. And it's $800. You get hit right there on the spot with an $800 bill. That in and of itself is going to produce, now it's a domino effect. Now you got stress because of the bill, which cancer feeds on stress. We know that, right?
Mm-hmm.
It's just a domino effect. So right,
that's some of the fears that patients have expressed is cost, right? And for things like breast cancer and cervical cancer.
Expensive.
Yeah. For breast and cervical cancers, if you don't have insurance and you meet certain guidelines, you can get Women's Health Medicaid, which will help cover maybe some of the costs that you incurred prior to getting that health plan.
Mm-hmm.
But it will follow you for 5 years in your survivorship. But, there's a cost of, I don't want to know if I have cancer, because if I do have cancer, I can't afford to pay for it. But know that most hospitals do have programs that they'll work with you.
That's true.
Right? You may not get,
that's very true.
top tier.
I found that out with my sister. With her breast cancer journey.
Right.
She had a couple of grants that she was able, her doctor was like, here, they called her and said, we put, you got this grant, you qualify for this, and you don't have to pay, but a very little bit or nothing.
Yeah. Don't be afraid to ask.
Mm-hmm.
Even
if she told them, she was like, I can't afford this.
Right. So what can you do for me? I'm here, or I need help. What can be done? And again, that the cancer site that I referred you to, there's a 1-800 number. If you're having those kind of struggles, and
give me that 1-800 number, because I want to put it on our screen. We'll do that. I'm gonna put that on the screen.
Sure.
What is that number?
So it's 1-800-227-2345.
227-2345. 1-800.
227-2345.
And is this a cancer hotline?
Yeah, basically.
Okay.
Yes. And so there's someone available 24/7.
Okay.
Okay.
You are really, really, really giving us some valuable information. I'm so excited to have you on the show. Let me put this up. I want to put this number up on the screen here.
So, Toni, we're talking also about, just in general, why patients are getting screened, right?
Mm-hmm.
So there's sometimes a low awareness of that cancer is a personal threat. Hey, I'm young. It doesn't run in my family. I'm not going to ever get diagnosed. There's a lack of knowledge of those screening benefits, that if I'm diagnosed early, my outcome is better than if I'm diagnosed late, right? Or in the case of colorectal cancer, you have a polyp removed and you prevented cancer, right?
Okay.
I also want to share with folks that for colorectal cancers, there's something called a stool-based test, often referred to as like a FIT, or you see, I just had a brain fart for a minute, but there's a 5-year cancer that testing that's on TV all the time, a stool-based test. Okay. Mm-hmm. So you can take those tests in the comfort of your home, but know that if they come back, you're going to have to get followed up with a colonoscopy.
Okay.
Sometimes there's fear of the process. I've heard those mammograms are uncomfortable, that they hurt. I heard that prostate exam is, sometimes I talked about the time factor, that life happens. They just got other stuff. They'll get to it. There's a cost. Sometimes there's structural barriers. There's access. I talked about being very close to providers when other folks are not, or those providers that they're close to don't accept their insurance, right? Sometimes, it's better for me if I can go after I get off from work. So we've been doing some work in all across the country in American Cancer Society, but I can speak to some of the work we've done in Georgia. So some of our sites have, for breast cancer initiatives, have said, okay, well, we might have to have a Saturday event. Okay. Or we might need to have a mobile unit come out so that they can get to us. We know that.
Mm-hmm.
So we can have a mobile unit come out, and we're going to have that mobile unit come out every year. So they're not having to find where to go when they need that yearly or bi-yearly exam. And we also have found, Dr. Toni, that we say that the doctor's recommendation is like the best thing going, right? Because people trust their doctor. But sometimes even doctors will make those recommendations and then don't do any follow-up. So they'll make the recommendation. And we just had this with one of my partners. They thought they were doing pretty good. They were saying, well, we recommend mammogram to everybody who's eligible, but our rates aren't very good. And when we did some work on a quality improvement level, they said, you know what, we're not following up. We don't follow up to see that that woman kept the mammogram and ask her, did she have a site that she preferred to go to? So now, before that woman leaves their center, she is either given an appointment or they know that she's going to contact her previous site and they're going to follow up. To see if that happened, and then make sure that she follows up with any diagnostic services that are required. And then if she is then diagnosed, help her with the treatment journey, getting her referred and making sure that that looks smooth.
Wow. Yeah, I was going to ask you, how do we get around those barriers as a community? And so I see some of the things that you're doing with the American Cancer Society. Can you tell us in a call to action what we can do?
Sure. So
as individuals, as community, as faith leaders, I'm a member of Alpha Kappa Alpha Sorority Incorporated, and we have a mammogram mobile unit, and I'm always so proud when I see it going around the country. We take the mobile unit around the country for women to do. I was recently in Tulsa, Oklahoma, and our unit was there. Our mobile unit was there doing free mammograms in the community and COVID tests in the community that we were in. So what can we do? Give us a call to action.
Sure. So my call to action is very similar for individuals as well, for themselves, and then helping their community, their family, etc. COVID has had a tremendous impact on screening for a number of reasons. Everything was shut down. So if you're behind in your screening, if you delayed going back for that diagnostic test, if you delayed treatment for any reason, we want to see that you're reconnected with your providers. It's important to have a primary home, a base of operation. Sometimes we go from doctor to doctor, but there's value in having a primary care physician or system who knows your history, who knows to pick up the phone and say, you missed your appointment. Let's make another one, right? Knowing the screening guidelines, but also having those conversations based on your family history, et cetera, when you should start. As a friend and as a community person, if you know that folks are fearful, help them walk through that journey. Sister, do I need to go with you today for that mammogram appointment? It's, a minute of discomfort could save your life. And it's really not as bad as it used to be, right? We need to advocate for our communities to get the COVID test, not only for themselves, but if you're unvaccinated and you spread COVID to a cancer patient or someone who's caring for a cancer patient, you brought in an additional burden to that family.
Wow.
In that situation. We want to make sure that we're maintaining a healthy physique or weight.
Yes, that's where I live and breathe. I was going to ask you.
Yes, we want to make sure that we're exercising.
How does our lifestyle fit into this preventative?
Yes, we want to make sure that we're active.
The healing journey if we are diagnosed with cancer.
Yeah, we want to make sure that we're active. We want to make sure that we have a healthy diet. The old things that we used to hear, fruits and vegetables, and decrease your red meat. If you're a smoker, it's never too late to stop smoking. Stop smoking. If you drink alcohol, monitor your alcohol intake. No more than 2 to 3 a week, right? And again, that Those are just the kind of basic things that you can do. Now, for
Okay.
some other cancers, there's some other risk factors, but you could have those conversations with your provider. But as somebody who works in the faith community, Dr. Toni, do what you're doing. Have those conversations. Have people connect in support groups, whether it's at your church or connect to community support groups if they're going through that journey. If you know somebody is fearful, there are support groups and navigators sometimes within health systems that can help them with those fears and overcoming those fears, help them virtually walk through their journey. Know that telehealth has become very, very popular. A lot of health systems were delving into it before COVID, but COVID made it necessary, right?
Mm-hmm.
So maybe you can't get off work to have that follow-up conversation following, a screen or a conversation, but you can call your doctor can call you and set up a visual conversation or a phone call even.
Yeah.
So from a church, you need to preach it from the pulpit. You need to have that information readily available to your congregants and have some health ministry leaders who are able to take up the fight, who are able to share statistics, who are able to talk about screenings, who are able to talk about support systems that folks can partake in, either as a caregiver or as a survivor. And on that cancer.org site, there's a whole list of resources for survivors and caregivers.
Wow. Ooh, you have just given us a whole clinic on surviving cancer.
High level.
And not just it, but and I want to say this. I entitled this conversation today, Surviving Cancer. And it's not just for those who have been diagnosed with cancer.
Right.
But it's for all of us. It's for those who have been impacted, because I'm surviving cancer now. My mother's gone on to be with the Lord. She passed away as a result of complications due to cancer. And so I'm surviving a cancer journey with my mother. You're surviving a cancer journey with your mother and others in our family and friends. We have friends who passed away of different types of cancers. So there's nobody in our society who's not been touched by cancer. And so that's why I'm so grateful that you helped me broaden the conversation today, because this is the month of October, and we know there's a lot of conversation, a lot of events going on around breast cancer survivors, and we are celebrating every one of them.
Right.
But it's so much bigger than just breast cancer. And so thank you for helping us understand how cancer impacts our life, some of the leading stats, cancers, incidences, mortality rates, breast stats, health equity, disparities, all of that, risk factors, everything we've talked about, reasons why people don't get screened. I'm sure somebody on here heard that and was like, yeah, that's me. That's good. And even how COVID-19 is impacting us in terms of cancer screenings and what we can do as a community. Thank you for the call to action. I appreciate what the American Cancer Society is doing. I appreciate what you're doing. We've had a long relationship, history, and partnership with you, our church has. And so I look forward to you coming back to the church and helping us with our celebration this year. This year, we're not gonna worship in pink. We're gonna worship in all the colors.
Awesome.
And we're gonna celebrate all our survivors this year. And I would love for you to be able to at least come in and greet us and say something to the congregation on that morning. Listen, Tonya, do you have any last thing you want to say to us as we close out today?
I just want to say that, Toni, I just opened up email from my CEO of American Cancer Society. And in her notes, she said, screenings is self-care. And I know you're all about self-care. And I was like, boy, this is right on time. Right.
Screening is self-care. And that's what we need to put that. That's going to be one of our hashtags. Screening is self-care. And listen, Tonya, anything I can do to even broaden that conversation with you all, please let me know, because I would love to partner with you
Toni,
all.
I want to keep you in the loop, because initially when we talked, we were talking about how to reach the faith-based community. And we're kind of coming around to having those conversations again. So I'll keep you posted.
We need to. We need to.
Okay.
Thank you so much. Listen, you all are listening to or watching the Harmonize Your Life Conversations on Self-Care for Women of Color podcast. You can find this podcast on Apple, on Google, on Spotify. We're also on the ATL Live, internet radio. We want you to know where you can find us. You can also find us on my YouTube channel. If you're not watching this podcast and you're listening to us on one of the other podcast platforms, run over to my YouTube channel. Please sign up there. Just subscribe. It's free. Just subscribe to the channel. You'll get notifications whenever a new episode is uploaded. We upload one every Monday. There's a new episode for each season that we're having these conversations on self-care, health, and wellness, for inspiration, information, fitness motivation, self-care strategies. Listen, we need this. We perish for the lack of knowledge. And I believe this is part of what God is calling me to do in this season. I believe God has stretched my ministry. What's interesting about that, Tonya, is I went to school for nursing and dropped out of nursing. And now, and when I went back, last year I did a certification in health and wellness coaching. And I told my husband and my mother, I said, I feel like I'm back in nursing school. But anyway, so God has a way of bringing us full circle. And I see now how the Lord is causing my training in Bible and theology to connect with my passion for health and wellness, and even some of my training when I was in nursing school, and how it's all coming together and harmonizing in this season of my life. Right?
I love it.
Yes. So please go to our YouTube channel. If you're listening, go there and subscribe to our YouTube channel, and you'll see all of our conversations cataloged there, as well as on Anchor and Apple and all the other places where you find our podcast. Ladies, this month, today we're in the month of October, and we have kicked off our fitness challenge. We kicked it off. Our fall fitness challenge is going on right now. You need to go to my website. Go to drtonyalvarado.com and sign up for my fall fitness challenge. And come on and get fit with us. You heard Tonya say that we need to get fit. We need to move our bodies. And that's one of the ways that we can stay healthy and do some preventative work, because preventative care is always better than sick care. All right. Preventative care is always better than sick care. And so we want to make sure that we do our part. I just told a friend today, we do our part and we trust God for the rest. Okay. So with faith is not foolishness. We have to do our part. Faith without works is dead. So get up out of that bed and move your body, eat right, drink water, do what you need to do to stay healthy. And then we'll believe God for the rest. Okay. Also, I want you to know you can go and get the Harmony Fitness apparel there. So while you're working out and being fit, you can also, while you're working out and being fit, you can also be cute while you do it. So go there and purchase some of my fitness wear. Listen, when you do that, you're supporting this work, because listen, when I do these podcasts, it costs to do this. It costs for cameras. It costs for people to help me produce music and things of that nature. I like to bless my guests sometimes when they come on. I like to send them a gift or whatever. You help me do that when you partner by going and purchasing the fitness apparel or my books or anything on my site. And also on that note, you can join the Harmonize Your Life Women's Self-Care Network on my website. That's another way that you can support. And Tonya is a member of the network. Yay! Tonya is one. And listen, the women that are part of this network, I'm so excited. God gave me this vision last year to start a women's self-care network. particularly for women of color, because of these conversations that need to be held in our community. And I have women from all over the country, Tonya, in our self-care network. Tonya is one of those. We have professional women, doctors, nurses. We have therapists, psychiatrists, fitness professionals, teachers. We have women of faith, pastors, pastoral leaders. We are doing it in the Self-Care Network. Just your everyday girl. We are a part of the network, and we are encouraging one another to stay healthy. We are motivating one another to stay fit. We are sharing resources and information with one another so that we can live our best life, and we can live lifestyles of harmony, wholeness, fit, healthy living, holistic living, fitness, and fun. And so please come and be a part of the Harmonize Your Life Women's Self-Care Network. We will do you good on your journey. Thank you again, Tonya, for being here with us on today. I look forward to more conversations with you in the network, on the podcast, at the church, walking through the park, wherever the Lord calls us to walk together. I appreciate it.
All righty. Thank you, Dr. Toni, for this opportunity.
No problem. We'll see you all again next week.
Bye-bye.
Bye-bye.
Hi, this is Dr. Toni Alvarado, and I want to personally invite you to join the Harmonize Your Life Women's Self-Care Network. Join us for fitness motivation, health and wellness information, inspiration, self-care strategies, and ideas for creating harmony in your life. As a certified health and wellness coach, it is one of my greatest honors to support women in their fitness, health, wellness, and self-care goals. Join the Harmonize Your Life Women's Self-Care Network, and we will do you good on your journey.